Today we'll talk about first blood, and then we'll talk about muscle. So as you can see, this picture of the presentation, it shows that the blood is a necessary, of course, provision of the body. No tissue, no cell, nothing can survive without blood, without proper perfusion. I'm sure you've heard the terms again, perfusion and vascularization. Perfusion means it means that when a tissue is perfused, we mean that this tissue receives blood from one or more vessels in a specific location. Perfusion is practically the receiving of nutrients, of oxygen, and of course wasting the byproducts of the cellular byproducts. This means perfusion. And vascularization is how many vessels exist in one specific location. So the thing is, as we already discussed about it, many vessels need to be present in one specific tissue because diffusion is a physical process that allows only for a small length to be properly perfused. Only a small distance only the small distance can actually is the criterion by which a tissue or a cell can receive blood. So our blood is made out of many different components. There is the cellular products and the non-cellular. So let's talk first about plasma. What is plasma? Plasma is the liquid part, the purely liquid part of the acellular part of the blood, and inside of it, practically most of it is made out of water. But there are, of course, other components such as proteins and other ions and solubles that are of major importance. So the most important thing to remember about the proteins of the blood is that the proteins of the blood exert and are responsible for the osmotic pressure, meaning that the albumin actually specifically is the major protein that allows for the the osmotic pressure to be in a constant concentration. The concentration of albumins indirectly controls the potential of a tissue or the blood to both practically provide nutrients and of course remove nutrients through osmotic difference. Albumin is one of the most important proteins that you remember absolutely, and you should always keep it in mind. Then the second biggest group is the globulins. Now there are different types of globulins. I'm sure that you already have heard about the antibodies. The antibodies are called gamma immunoglobulins. So immunoglobulins, the antibodies, are part of these globulins. But of course we have also other types of globulins in the body that perform different functions. Just one example is enough to remember. For example, the antibodies, the gamma immunoglobulins. Then we have other proteins such as fibrinogen, which is responsible for the coagulation. It plays a major role in coagulation of the blood. Coagulation, of course, is the process of formation of a blood clot and maintenance of the blood clot. So this is pretty much some minor information, some small information about the plasma. Now let's go to the part that actually is much more important, the cellular part. Most of our blood is practically made out of, the cellular part is made out of the erythrocytes. Specifically, the erythrocytes have one major function. We'll discuss them in detail, but in short, it's the function of bringing oxygen and taking away carbon dioxide from the cells and the tissues of our body. Now, when it comes to the other cells, we have leukocytes, the white blood cells. These are mostly immune-related cells, and we'll see which functions exert step by step. And lastly, we have the platelets. Now, the platelets is a topic of a minor controversy between histologists and generally biologists and doctors, because as per the definition of a cell needs to have a nucleus. Platelets do not have a nucleus. Platelets only have, of course, other components. We'll discuss the components, but they contain components that are, but they don't contain a nucleus. So with no nucleus, with no mitochondria, there is no potential to exert and to produce anything. They're just simply practically storage components, let's say. Some scientists think of them as cells, some do not. So we're gonna see different types of cells. Then of course they all come from the hematopoietic stem cells. The hematopoietic stem cells are the ones that will give rise to to all of the types of the cells in the blood. We have the lymphoid progenitor cells and the myeloid progenitor cells. And of course, these are differentiation points after differentiation of the hematopoietic stem cell. So the myeloid will give rise to some of the white blood cells, as we see in the bottom, and of course all the components that make up the platelets and the erythrocytes. and the lymphoids are going to give rise to the lymphocytes. Now these can be NK cells, natural killer cells, or the typical lymphoid cells, lymphocytes that we know, B and T lymphocytes. We'll discuss their function each by each and step by step. So in order to study the blood, in order to see how a patient's blood actually, the components of the blood of the cell of the components of the blood of a patient, we have to, of course, prepare the blood smear. I'm sure you've already done this in biology. If not, the process is really simple. You put one drop of blood on the slide, and then with a second glass, let's say glass plate, we can actually approach the drop of blood, and then smear it on the blood smear. Now, this procedure is going to give us, actually, this is a very nice schematic of how this is done. Again, a drop of blood is placed, the glass is approached, and then the smear, and you close it up and you top it up. And this is the result of this process. Now, what we see macroscopically is going to be this. Actually, here we can see, let's say, 3 different parts when it comes to the components of the blood smear. In the first part, the head of the smear, the head of the slide, we'll see typically just an insane amount of erythrocytes, and just only erythrocytes, and that's all we're going to see at this point typically. In the tail, we're going to see it's not going to be condensed enough. We're not going to find many cellular elements here. So the ideal location to find and to see all of the different types of the cells. This is the head, for example. This is the head right here. This is the location that we see. Not clear, overcrowded erythrocytes, and the few other cells that we can see are not very clearly seen because of the thickness of the slide. So this is the ideal location where we should look inside the slide to actually visualize many different types of the cells and the components, and to specify the details of this content. This is what it actually looks like. A much clearer picture, less thick, and we can see clearly different types of cells. Now, let's go through the cells one by one and discuss their functions specifically. So, first we discuss about the erythrocytes. The erythrocytes, as I said before, the function of the erythrocytes is to bring oxygen and take away carbon dioxide. There is one trick to the red blood cells. That is their shape, their morphology, and their function. Meaning that these are actually very, very small cells, 7 to 8 micrometers. This is actually very interesting. Why? Because if you remember, if you know, actually the capillaries can reach of the diameter of up to 4 micrometers. Now, 4 micrometers of diameter of a vessel and 7 micrometers of the erythrocytes, that just doesn't add up. It means that a bigger cell has to go through a smaller space. And this is where the actual function of the erythrocytes comes into play, and their structure comes into play. These cells are highly flexible, meaning that these cells can actually go into shorter shapes and to change different shapes, and of course compress themselves or compress their structure. They have a biconcave shape, meaning that these cells are practically, there is a concavity in the center, and there are 2 loops on the 2 heads, let's say, of the erythrocyte on the sides. So, because of this structure, because of their content, of course, and their structure, they're allowed and they're able to practically condense and to flex inside the vessel, the capillary specifically, and allow the cell of the 7 micrometers diameter to pass through a 4 micrometer vessel. These cells actually have no nucleus. This falls again under the point of this conflict that we discussed before, whether a cell has a nucleus. And some scientists, of course, say that because they have a specific function, they are considered cells. Some, because they don't see the nucleus and there is no nucleus in the erythrocytes, do not consider them cells. This is typically just a matter of theory and not of function. What's important to remember is that we find many different components of inside these cells, inside the red blood cells, and one of the most important is the hemoglobin. Hemoglobin is the protein that allows this red blood cell to practically engage and to attach the carbon dioxide and to attach, of course, the oxygen, and provide an exchange of gases between the tissues and the red blood cell itself. What's also interesting is that these cells can circulate for 100 or 120 days. This is quite a long period of time, depending on, in comparison to the other types of cells we're going to see. So this is the pretty practical picture that we're going to see in the histology in the slide, and this is what it actually looks like. No nucleus present, and we can see many overlaps one on top of the other. So let's move on. Next we have the megakaryocytes. we didn't discuss these cells, and it actually can take some by surprise. And this is because these cells are the progenitor cells, the cells that actually produce the platelets. These cells do not exist in the circulation. They only exist in the bone marrow. So, of course, the bone marrow, as we discussed in the bone lecture, is the location of hematopoiesis, which means what hematopoiesis means, the production of blood. So, in fact, these megakaryocytes are located within the bone marrow, and their function is to practically make these small aggregations in the cytoplasm, and these small aggregations bud off, practically go out of this cytoplasm, and are the platelets. So these cells are practically the ones that produce small intracellular bud that eventually will go out of the cell and practically function as the platelets. These are actually quite big cells, and even one cell can produce up to from 5 to 10,000 platelets. This is an insane amount of cells. So they have short lifespan, 7 to 10 days. Now let's see about their products. This is a typical picture of the platelets under, of course, special staining and other specific procedures. So there are two different parts that we can see in the platelet. One is the hyalomere, which is the part that is this glossy hyalo. We saw again the term hyalo in hyaline cartilage, which means glassy. So because of this the glassy part practically contains nothing more than macrotubules, which is part of the cytoskeleton, and this is macrofilaments, allowing the platelet both to move and to do different procedures when it comes to mobility and coagulation, and you'll see these processes actually later on in physiology. So, and they play a role, of course, in coagulation and the whole process of formation of blood clots. The other part, the most important part actually, is the granulomere. The granulomere contains practically all the organelles that make up the function of the platelet. We have the dense tubular system. This is the dense tubular system in cyan, this color. These practically contain calcium. Calcium, as we discussed, it's not only just an ion. Of course, it's an ion, but the capacity and the possibilities of the calcium are endless. This is practically a molecule that activates and induces cellular processes. This is a very, very unique ion that induces functions to some cells and other into muscles. We'll see, of course, later in the muscles, but we can see that, and we know that when calcium is actually inserted or somehow close to a cell or inside a cell or even in the periphery of a cell, it works as an inducting point. It goes to the receptors and activates specific process. This is practically a ligand. So then we have the alpha granules that contain the clotting substances. The purple, these are the big ones, that contain all the substances that actually play a role in the coagulation and the formation of the clots. And lastly, we have these delta granules, the yellow, these tiny ones, that actually play a role in adhesion and vasoconstriction. Platelet adhesion and vasoconstriction. As we know, the process simply put, the process of clot formation is that when we have a cut or disruption of the vessel, of any vessel, then we have the platelet. For platelet focusing at this point, many platelets aggregate together to form the clot, and then we have the coagulation, which is the process of establishing this blood clot in this location and allowing for the healing to take place. Now, let's move on to the leukocytes, the white blood cells. So here, of course, the first cell that we see is the neutrophils, also called polymorphonuclear. In fact, this name is ideal. Why? Because polymorphonuclear denotes many of the properties of these cells. Specifically, poly means many, morpho means shape, nuclear is the nucleus, of course. And this has to do with this specific architecture and morphology of these cells. These cells are not typical. The nucleus is segmented and can have 2 to 5 lobes. Why is it important? Why should we even care that this cell has more than 1 lobe? Well, this is because the number of lobes within this cell gives us information. What type of information? Typically, these cells are cells of infection and inflammation. These cells are found in infection specifically. Whenever we have any sort of pathogen close to a specific area or an organ or whatever tissue this is, the first step of acute inflammation will be the presence of these cells within this. So these cells actually tell us and inform us if there is an infection taking place, specifically bacterial infection. These cells counter bacteria, among others, but one of the most important is the bacteria that we find. So these lobes, whenever these cells typically start with 2 lobes, so the nucleus starts with 2 lobes, and the more time it spends, and the longer this inflammation is taking place, these cells, these nuclei, keep on segmenting and more and furthermore and furthermore. Meaning what? Meaning that whenever we have a bacterial infection, let's take an example, and we have the initial inflammation, acute inflammation, we're going to find these cells in the beginning, in the first, let's say, hours, we're going to have the presence of 2 lobes, 2-lobed neutrophils. So the more time progresses, we can see more lobes. So if we see a blood smear of a patient that has a neutrophil with many lobes, we can easily assume that this infection, this inflammation, is not just that acute, it's been progressed, it's been there for some time. It's been there for some time. So this means that actually we can time, it's a method that we can time the infection and the process and the progression of a disease in a patient. These cells cannot mitotically divide anymore, and they're at the end, they're the last step of differentiation. Interestingly, they circulate in the blood for a few hours, but once they go inside the tissue that we care for, specifically this process is called diapedesis. We'll discuss it right now. But the thing is that when they're in the peripheral circulation, they only survive 1 to 2 days. When they're in the circulation, they can survive for a few hours. If there's an inflammation taking place, then these cells will diapedese, will practically go inside this location and survive for a way longer time, 1 to 2 days. So, as I was saying, the process of diapedesis is the process of how one white blood cell or any other type of cell, specifically in this case white blood cell, can go from the circulation towards the interstitial space. Interstitial space, of course, where there is another cell that actually induces segregation. Typically are macrophages. Macrophages typically produce this chemotactic stimulus. Meaning what? Meaning that the chemotactic stimulus, when we have an inflammation or infection, this macrophage is going to phagocytose part of this cell or bacteria or whatever it is, and induce and produce cytokines. As we said before, cytokines are molecules that actually activate the mobility, and they actually put into motion a specific process. So in this case, this is inflammation. So these cytokines will actually activate and allow for the endothelial cells, the simple squamous cells of the vascular endothelium, the part, of course, the inner part of the vessel, specifically a capillary here, and will actually activate to produce receptors on their top, on their cellular membrane. So these receptors are ideally they're ligands, and actually, these receptors can receive the ligands and actually grab on the ligands. So this neutrophil contains, let's say, these ligands, of course, these proteins typically, that actually will adhere and attach to these receptors. And after this attachment, we can see that this neutrophil is going to slow down and practically eventually progress and go inside the interstitial space. This is the process of diapedesis. Now, let's move on to the other types of white blood cells. Then we have the eosinophils. Eosinophils. Actually, we'll discuss. Eosinophils are cells that actually are, of course, they're white blood cells that play a role in the countering the parasitic infections, parasitic and helminthic infections. Typically, of course, parasites again. So when we have the blood work of a patient and we can see that the eosinophils are high, then we can easily conclude that one of the major causes, the easiest, let's say the most common cause of high eosinophilia, is the presence of a parasite. So the eosinophils are typically in low concentration, 2 to 4%, very, very low. So any increase can actually give us information that something's wrong with the parasite inside this patient. These cells are called eosinophils simply because their granules are, of course, of eosinophilic color, and they're very easy to spot. Very rare, but very easy to spot as well. So they can circulate to the blood in 8 to 16 hours and can survive, if they diapedese in specific location, 2 to 5 days. As you can actually see, generally the cells of the immune cells are actually survive not long, only very short, for short duration inside the circulation, but when we go inside the tissues, they can survive for much, much longer. Now, let's go to the other spectrum. Of course, we have the eosinophils, and now we have the basophils. Now, the basophils actually are very, very similar to the mast cells. We discussed mast cells in the connective tissue. So, the function of basophils is, of course, again in allergy. They produce similar molecules to mast cells. Again, histamine, serotonin, heparin. The function of histamine, as we discussed before, is the vascular vasodilation. That's what you can see in allergy, the many red spots, and the smooth muscle constriction. That's why you can see this gasping for air in a patient that has allergic shock or hyperallergic reaction. Serotonin and heparin. Heparin, of course, is a molecule that plays a role in coagulation. It actually, it's one of the very important molecules. It plays a role into the prevention of clot forming. Many patients will actually treat with heparin or heparin-like molecules. So the basophils, of course, again, are called in this way because their granules are basophilic in the center. So we have the eosinophils, which are acidic eosinophilic color in their cytoplasm, basophilic that also contain granules of basophilic content, and the neutrophils are because they have neutral. There is no specific affinity to either eosin or hematoxylin in this case, or eosin or hematoxylin. So neutrophils goes again. They contain granules, but are of no specific affinity. Let's move on. Monocytes, one of the most important cells in the human body. Why? Because monocytes can actually, even though they're just immune cells, they can of course phagocytose. They can differentiate into macrophages, very important cells. But monocytes play a role in the mononuclear phagocytosis system, which means that monocytes can actually change, fuse, or actually do many differences. For example, we saw the monocytes fuse together to form the osteoclasts. But typically, monocytes, let's say the most common form of the monocytes is in the circulation, and of course in the interstitial space. When they go into this interstitial space, they become macrophages. They differentiate into macrophages. So these monocytes, of course, are the prime function is phagocytosis. Once they perform the diapedesis and they're inside this tissue, inside the peripheral tissue, interstitial tissue, and they have a very unique shape. They have this kidney lobe shape. So let's move on. Let's go to these lymphocytes, the B and T lymphocytes. It actually is very difficult to differentiate through hematoxylin and eosin if this lymphocyte is going to be B or T lymphocyte. So what we can, because they are actually very morphologically similar. In fact, we can see the common features, which are the very big lobe, very big nucleus, to very small amount of cytoplasm. Always this proportion means that there is a high rate of mutation within the nucleus. Of course, when you study immunology, you'll see that, of course, mutations is what actually take place in a healthy, let's say, boundary within these lymphocytes, and practically these cells predict the type of antigen they will counter. Long story short, these cells have a very big nucleus with short cytoplasm, and this is because there are many active nuclear processes taking inside place. The things we can see, the lymphocyte that we can clearly understand and see visually easily, is the plasma cell, because the plasma cell has one nucleus on the head, let's say, and quite enough cytoplasm on the other part of the cell. So these cells, of course, are produced in the bone marrow, and then both T and B white blood cells are produced in the marrow. They can differentiate in their respective organs. B for bone marrow, because they differentiate. But they're both produced and differentiated in the bone marrow. And T lymphocyte comes from the word thymus lymphocyte, because in the beginning they're produced in the bone marrow, but then they differentiate and they mature. Specifically, mature is the proper word. They mature in the thymus. So hence the term T lymphocyte. So this is a very quick sum of the cells we discussed. Basophils, of course, they're responsible for allergic reactions. Again, they produce heparin, serotonin, and histamine. Eosinophils are responsible for the countering, for fighting off parasitic infections and helminthic infections. And lastly, we have the neutrophils, which are the cells that are responsible for the countering of typically bacterial infections. So clinically speaking, they're very important, because if we see high neutrophils, we can easily conclude that this patient has a bacterial infection. If we see high eosinophilia, we get high eosinophilic counting, which is eosinophilia practically. This means that this patient is fighting off a parasitic infection. If we see a high basophils and mast cells, we can easily see that this patient is having an allergic reaction. Of course, the last one, the allergic reaction, will be evident from many clinical symptoms, but we can actually see it also in the blood work. Then we have these were the granulocytes, because they contain granules in the center, and we discussed already the difference between the basophilics, eosinophilics, and neutrophils, the affinity to hematoxin or eosin. And the agranulocytes, the cells that practically do not contain granules, are the lymphocytes and the monocytes. Again, we discussed the function. Monocyte is part of the mononuclear phagocytoid system, which actually allows them to differentiate into many different cells, macrophages, Langerhans cells, or in pathological conditions, and of course the osteoclast that we've seen before. And the lymphocytes, we have the common features. The B and the T lymphocytes look practically similar in the macroscope. This is a very nice table taken from Jonquière that actually sums up everything that I just said right now, and this is very useful. You should absolutely pay close attention to the name of the cells and how they look like typically, if there are lobes in the nuclear shapes, and lastly their function.